My name is Michele, COO and co-founder of Femgevity Health. We are a personalized digital healthcare for menopause and longevity. And what we do is we really figure out a way to revolutionize menopause treatment with feminine longevity care. And we combine with our telemedicine platform, AI-powered DNA testing, extensive hormone assays, in-depth symptom analysis, and we tailor every treatment plan to each woman's unique health journey, And what this does is it really counters the outdated one-size-fits-all healthcare model that we've been living, and it's been empowering to women to live healthier, longer lives. And yes, there are other digital health medicine companies out there, but we are really one of the forefront winners in longevity medicine to help women understand the importance of health span and medicine 3.0, no more spot treating, and getting women really to their optimal levels to prevent disease during, when you start going through perimenopause and menopause and your symptoms are at peak, that's when you want to treat them before your disease really sets in and goes untreated. So worldwide, there's about 1.1 billion women that are experiencing menopause. And I'm sorry, my slideshow is acting crazy right now. I don't know why I won't stay there. Women on average spend about $20,000 in menopause treatments, whether that's, RX, supplements, creams, lotion, hair treatment for loss of hair, a plethora of things. And it's a huge dearth, and they've had nowhere to go. 1.1 billion women represent about 12.5% of the population, which means 1 in 8 people on the planet will be menopausal, including babies and children, which I find interesting. I apologize. I don't know why my slide is acting crazy. So we're living longer, every year people are living longer, and 47 million new menopausal women each year. Alone, that's 50 million menopausal women. The UK alone has 14 million women reach menopause daily, and 4.4 million in the workplace, which is the fastest growing demographic in the UK. 50% of the world's population go through menopause, whether it's your sisters, relatives, partners, colleagues, peers, mothers, the woman that delivers the male woman, everybody goes through it. Unless you're deceased, you're going to go through menopause. It's the one ailment that every woman experiences, and yet it's been lacking in research and development and treatment options. Okay, here, this one's going to stay put. So some of just, enlightening things that 85% of women experience menopause symptoms, 78% it interferes with their lives, hot flashes, irregular periods, mood changes, everything that everyone's been talking about. And which is really enlightening is about only 20% of OBGYN residents programs actually focus on any type of training in menopause. So it just shows that the lack of resources out there for women. Now I want to really go into, well, what does menopause cost the workplace? It costs the workplace a lot of money. And the workplace is very focused on pregnancy and mental health, but there's been no innovation in benefits and point solutions for workforce benefits. Costs about $1.8 billion in lost working time per year. There was actually a recent Mayo Clinic study, it was published, and the paper examined how hot flashes, night sweats, mood swings, the myriad of symptoms associated with this time of life affects women in the workplace. And it's the largest study of its kind. And it has been done in the United States. That just came out in 2023, this past spring. And those who reported the very worst symptoms were 16 times more likely to report such outcomes than those with the least severe symptoms. A little over 1% said that the symptoms have become so debilitating that they either quit their jobs or they were laid off preceding this 6 months. And menopause is actually very biracial. So it's not the same. It's not a one size fits all for every ethnicity. It's very diverse, inclusive. Black women tend to have more menopausal symptoms, and a higher percentage of Black women and Hispanic women actually report adverse work outcomes related to menopause symptoms. So it just shows that there needs to be very specific, carved out solutions, not one size fits all, right? As far as treatment plans like Femgevity does, it's not one size fits all. So either should workplace benefits and solutions. And actually, part of that, there was a survey by Carrot Fertility that showed 20% of women took time off of work because of menopause. So it's infected women, and it's impactful. Women are among the fastest growing demographic in the workplace. Women are having children later. They're working later because they're building their careers. 8 out of 10 women are in the workforce. And because women are living longer and men are living longer too, but retirement ages are going up because they're staying in their careers, they're advanced, the cost of living is more expensive. So people work more to save more. 1 in 3 of the workforce will be over 50 years old, and there's still not enough solutions out there and carved out in corporate solutions in the workplace. A lot of people what they don't realize is menopause is actually a retention issue. So when you're retaining staff, there's shortage of staff. 12% of women, like we said, leave the workforce. There's a hard with attracting talent. You can't attract talent if a woman is trying to switch jobs and go to a company that she knows she's going to be going through, or she might be in the midst of going through it. And it's very stringent with PTO, with being able to walk away, with having different support and options. And when it comes to performance, companies need to think about the cost of replacing employees is significant. So instead of having to replace them, let's hone in and lean into them and find solutions to keep them there. And it actually saves the company financially as well, and keeps their talent. Some of the things is we need to focus on is the time off. 4 in 10 women have been shown to miss time off. 22% of women miss 3/4 of the days off of their work calendar. And most women don't feel comfortable with going to their manager, especially if it's a male, that she's having hot flashes, that she's cramping, that she has a headache. There's a very different stigma with women complaining about symptoms compared to men. So what it comes down is solutions, right? So we need information and education. Menopause awareness training, provide education and training for managers, coworkers, can help dispel myths and stigmas. Information resources, another one, supplying brochures, webinars, workshops, help employees understand menopause, can empower both men and women to discuss it openly. This isn't just a woman's problem, it's the men's problem too. It's relationships, it's brothers, it's, parents and grandparents and uncles and friends. Flexible working conditions. Symptoms like insomnia affect performance. If you're exhausted and fatigued and having brain fog, you definitely can't get through a meeting. You can't prepare presentations. Allowing flexible work hours can immensely be helpful. Offering the option for remote work can help manage sudden symptoms. Another one is physical environment adjustments, temperature control, personal fans, air conditioning, thermostats, comfortable furniture, ergonomic furniture that is breathable, comfortable, eliminate discomfort. Another big thing is health support. Let's have on-site professionals, maybe NAMS trained nurse practitioners, wellness programs, relaxation sessions, and a medical leave policy, a more generous medical leave policy that helps women manage severe symptoms without having the stress of losing their job. Another important bucket is emotional support. Support groups provide space for employees to discuss menopause, foster a sense of community. Counseling service, offer free or discounted counseling. It can provide support and physiological support for these women and their family as well. We need policy and documentation. Explicit policies, creating menopause policy that sets official guidelines for supporting effective employees, assure employees that their privacy will be respected and there's no banter behind their back, and they can respectfully discuss symptoms and accommodations. open channel communications, anonymous suggestions, concern to these menopause related issues. Managers need to have regular check-ins and have open dialogues with employees to offer support and to make adjustments for the employee to be open. And not just even the female employee, I'm also speaking towards the male, right? The male employee might have a spouse or a girlfriend at home that is going through this, and they need to understand it as well. So this is a two-way road. And lastly, financial support. The healthcare system doesn't pay for menopause. It doesn't pay for menopause treatments. Sometimes HRT will be covered, but ensure that menopause treatments are covered by the insurance company that has your plan. If not, give them extra benefits for their HSA and FSA to cover it. Subsidize medications, provide financial assistance for hormonal and non-hormonal treatments, not just for bioidenticals and HRT, but supplements and nutraceuticals, IV drips. There's a lot of different solutions, and these companies support women going through menopause, but they also improve the overall workplace well-being. And my last three here is, I know this is a long laundry list, but there's just so many options. And diversity and inclusion. We need a more diverse workplace to support all cultures, and having appropriate policies can set a positive message for the workforce. Acknowledge that menopause symptoms are treated differently for different ethnicities. Have menopause trained nurse practitioners. Make sure the managers also get training to be empathetic, supportive, manner of responsible attitudes and actions. And this really helps reduce litigation on the corporate side and the business side too. Because there have been actually recent litigations for menopause situations in the workplace where women felt that it wasn't handled properly. And just draft a policy for your retention plan with clear objectives to raise awareness. Educate on, there's 100+ symptoms that women experience. It could be from itchy ears to, having gut microbiome issues. It's everyone talks about the 5 pillars with, insomnia, fatigue, brain fog, anxiety, sweats, but there is 100+ symptoms that women think that may be autoimmune related, and they're not. So you need education. You need a very supported staff. It's not just having your HR person do an online training and teaching. You really need to get granular and get clinical. Get someone clinical on the team who really understands it, so you really can prevent disease. And in the long run, the companies are going to save money, and not just with healthcare and premiums, but with also retaining their employees. So that is what I have to say, and thank you for listening.